let's answer this question, right? So same principle. This is your body, this is your stem, which is the examiner question, and then your answer keys. Right. So let's do this. Now, the body of the question is saying we have a nurse planning care for clients who have what? COPD. Then the NCLEX is saying extra other information. They said the COPD client, right, report what? Increasing shortness of breath. So now, there's one thing I want you to know about the NCLEX. If the NCLEX just put the question like this: the nurse is planning care for clients with COPD and they stop right here. It means that the NCLEX is asking you to think about everything that occur with a client who have what? COPD. But now when the NCLEX said who reports increasing shortness of breath, what that means is that the NCLEX is telling you to forget every other thing that occur with COPD and focus on what? Shortness of breath. Then give the intervention related to what? Shortness of breath. So now let's think about it. Now the NCLEX is saying you should do pulse sleep breathing for the shortness of breath. Is that what we want to do? Obviously, it's a good intervention. Yes. Now, should we lie flat for shortness of breath? Obviously, we want to be in what? High Fowler position. So what? No. Should we administer high flow oxygen? Now, there's one thing you need to know about COPD, right? Any other patient can take any amount of oxygen, but you see the COPD patient, they must maintain 2 to 3 liters, nothing more than that. If not, then they will have problem with their breathing and they can die, right? So we don't want to do this. You can see this red flag. Wrong. Now schedule all activity those together. Now generally, let's forget about COPD right now. Generally, let's talk about generally we don't encourage patients to do all activity. Now you can see answers like this related to multiple sclerosis as well too, or maybe some other condition that involve high level of stress or conservation of energy. We don't encourage client to do all activity. Now you can say, oh, I encourage the client to do all house chores in the morning. No, we don't encourage them. We encourage them to, like, they should like do pacing, right? They should pace, do like some in the morning, do some in the afternoon, and do some in the evening. NCLEX can tell you complete all your house chores in the morning when fully rested. Don't fall for that trick. The thing is, when NCLEX use that keyword all activity or all house chores, the patient is still going to get tired. Instead, they should pace everything they want to do. They should do some in the morning, afternoon, in the evening. If you do all, you get tired again. So there's no going to be conservation of energy when you do all activity close together. No. So that is why this is wrong. So you're left with number one, and then number one is definitely the answer to this question.